Pregnancy loss is a deeply personal and often devastating experience, impacting countless women and families worldwide. While miscarriage, the loss of a pregnancy before 20 weeks, is relatively common, it can be incredibly challenging to navigate, both emotionally and physically. One type of miscarriage, known as an incomplete spontaneous abortion, occurs when the body begins the process of miscarriage, but the pregnancy tissue is not entirely expelled. This can lead to discomfort, bleeding, and emotional distress. Understanding the complexities of incomplete spontaneous abortion, its management options, and the potential causes is crucial for both women and their healthcare providers. By fostering open communication and providing evidence-based information, we can empower women to make informed decisions about their bodies and emotional well-being during a difficult time. This essay aims to provide a comprehensive overview of incomplete spontaneous abortion, focusing on the clinical management options available. We will delve into the details of expectant, medical, and surgical management, highlighting their respective pros and cons. To illustrate the complexities of managing an incomplete spontaneous abortion, let's meet JM, a 32-year-old woman experiencing her first pregnancy. JM was elated when she saw the positive pregnancy test, her joy shared by her partner. They eagerly anticipated the arrival of their little one, meticulously planning for the future. However, at 10 weeks gestation, their world shifted. JM noticed spotting, which progressed to cramping and heavier bleeding. Filled with anxiety, she contacted her doctor. An ultrasound revealed JM was experiencing an incomplete spontaneous abortion. The pregnancy was no longer viable, and while some pregnancy tissue had passed, some remained in her uterus. JM was devastated. The news was difficult to process, the emotional pain compounded by the physical discomfort she was experiencing. JM's story is not unique. Many women face similar experiences, their lives touched by the heartbreak of miscarriage. Her story underscores the need for compassionate, individualized care and emphasizes the importance of understanding the range of management options available. Managing an incomplete spontaneous abortion involves a shared decision-making process between a woman and her healthcare provider. 3 primary management options exist: expectant management, medical management, and surgical management. Each option carries its own set of benefits and risks, and the best course of action depends on individual circumstances, preferences, and clinical factors. Expectant management involves allowing the body to naturally expel the remaining pregnancy tissue without medical or surgical intervention. It is often considered the most natural approach and can be a suitable option for women with mild symptoms and no signs of infection. However, expectant management requires patience, as it can take days or even weeks for the tissue to pass completely. It also carries a higher risk of prolonged bleeding and may not be appropriate for all women. Medical management utilizes medication, typically Misoprostol, to induce uterine contractions and expel the remaining pregnancy tissue. Misoprostol is a safe and effective medication for managing incomplete miscarriage, offering a quicker resolution compared to expectant management. However, it can cause side effects such as cramping, bleeding, nausea, and diarrhea. Surgical management involves a minor surgical procedure called dilation and curettage, or D&C, where the cervix is dilated and the remaining pregnancy tissue is gently removed from the uterus. D&C offers the most rapid resolution and ensures complete evacuation of the tissue, reducing the risk of infection or prolonged bleeding. However, it is a surgical procedure with inherent risks such as infection, bleeding, or uterine perforation, albeit rare. Navigating the emotional and physical turmoil of an incomplete miscarriage is never easy. After careful consideration of her options and a thorough discussion with her doctor, JM opted for medical management. She felt this approach offered the best balance between her desire for a natural process and the need for timely resolution. JM was prescribed Misoprostol and provided with clear instructions on its administration and potential side effects. Her doctor reassured her, explaining that while some cramping and bleeding were expected, these were normal parts of the process and typically manageable with pain relief medication. JM was also given emotional support resources and encouraged to reach out with any concerns or questions. Choosing the best treatment for an incomplete spontaneous abortion is a deeply personal decision. Open communication, trust in the doctor-patient relationship, and access to accurate information are paramount.